Well, hello and welcome to this special broadcast from the Tribune Network. I'm Rohit Bhan. COVID cases continue to go on a surge. There's a surge in the COVID cases across Punjab. 53 deaths in the last 24 hours. Also, over 2,000 cases in the last 24 hours. I'm joined by my senior colleague and Punjab Bureau Chief Sanjeev Briana. First, Sanjeev, what are the new concerns?
The biggest concern at the moment is the second surge, is the high surge that we are witnessing now.
Right.
It's not just in Punjab, has become at the national level, where the rise has been more than 40,000 from the last 4 days successively. And if we are talking about Punjab, by the end of January, the number of cases daily had come down to 200. But Punjab witnessed 2,274 cases in last 40 years and 53 deaths, which and Doaba surprisingly has emerged as the biggest reason, which has witnessed 14 deaths in Jalandhar and 9 in Hoshiarpur. These are the new developments in Punjab.
Okay. And why is this happening?
See, the biggest thing with COVID is that there are no definite answers as of now. The doctors are still working on it, the researchers are still trying to find the real reasons, but one very obvious thing that's visible is that people have become relaxed. They are not following the COVID norms. We again see the huge rushes in the markets. We are again seeing big gatherings and the functions. And also, people are not wearing masks. So all this is definitely adding up to this. And people and government has come out with strict discipline. If this continues, if the discipline sinks in, then the numbers will show that what was the big reason.
And also, there have been concerns. In fact, we've also reported about the cases likely to go up. I mean, some experts suggesting that by weekend, perhaps the numbers could touch 3,000, though the numbers are now at 2,200. So, what is the government thinking about it? Besides becoming stricter with regards to COVID violations, what are the government plans?
I think Chief Minister Captain Ramendra Singh gave a very big pointer day before yesterday when he said that 81% of the recent cases in Punjab where about 401 samples were taken, they were found to be variants of a UK virus.
Right.
To which the centre responded immediately saying that 795 variants from Brazil, South Africa and UK have been reported. What's happening now is that the young are getting affected.
Right.
Because the young are getting affected, yesterday the centre announced that people above the age of 45 will now be inoculated. So these are the new concerns, these are new developments. The original virus is there definitely, but the new virus has changed the total mathematics of how they're going to deal with it. The situation is emerging on this front.
And also, Captain has requested the Prime Minister that more and more people should be brought under the ambit of the vaccination. You know, there's only more relaxation in terms of age. What is the take within the government? What is the government saying? The age limit. I mean, now from 1st of April, 45 plus will be vaccinated. But is there a thought within the government that the age relaxation should be made further?
I agree to the fact that relaxing the age is a very good development since the new variants are showing that they are impacting the young.
Right.
That's right. But at the same time, we also need to realize that people are not going ahead with the COVID. With the total supplies that Punjab has got till date, roughly about 8 lakh, less than about 50% people have got themselves vaccinated. So besides asking the government to reduce the age, people also need to be participative. It affects them, it's their health.
Right.
Besides the government, it's people who themselves should be coming forward and getting themselves vaccinated.
And is this a very big concern area that not many people have volunteered for vaccination, given the fact that the numbers are really going up?
Definitely, people not getting themselves vaccinated is a big concern. Let us see what happens on this front. It is a big concern, there's no doubt. People have to get themselves vaccinated.
And also, Sanjeev, though the government says that it has taken whatever steps it could to tackle COVID, but as we've been reporting, there are certain issues like a story which we did that about ventilators lying unused at a time when COVID cases are going up. I mean, take us through the story that there are some ventilators which have not been used.
The ventilators given by the center under special scheme, 149 of them, they were supposed to be taken by the government health department and given to the government hospitals, but they were never taken. So while our reporter was doing the story, he tried to get across the facts and realized that one of the biggest reasons the hospitals gave was that they did not have adequate manpower to handle them. They did not have trained manpower to handle them. Okay. So now what's being done is that these are now being given to private hospitals to be let down. So this, I think, is definitely a case of resources having gone waste.
But are they being used now? I mean, will they be distributed?
Let us see how it happens. A decision has been taken, and private people have been. It has been said that they will be given the ventilators. Let us see.
Okay.
Hopefully.
Okay. And also, what needs to be done now by the state government?
See, the case still is that we know that the fertility rate in Punjab has almost halved than the original. That's a nice development. But at the same time, we cannot let go of the fact that the number of cases are rising daily, and a lot of it. So I think we will have to go back to the very basics of maintaining the social distance, of getting our face covered, and most importantly, getting ourselves vaccinated.
Thank you, Sanjeev. Thank you so much. So, as Sanjeev mentioned, we have to go back to basics. One, maintain social distancing norms, adhere to the guidelines, COVID guidelines, and also, as we've been discussing, the vaccination rate pretty low in Punjab. Not many people are coming out and volunteering for vaccination. That's something which is a concern area. We'll keep on following the COVID surge in Punjab. The story, it's a big story which we'll be following. You can also log on to our website, tribuneindia.com, and also follow us on our other social media platforms like Twitter, Facebook, and Instagram. Meanwhile, thanks for watching.